Good morning to all the viewers of Valenzuela Land, DepEd Valenzuela. To our dear learners, most especially to our grade 8 Mapeh students. It's me again, Christian Moises Carlos from Disciplina Village, Bitnay National High School. I will be your teacher today in Health Aid. Before we formally start our lesson, please prepare your module in Health Quarter 3 and your pen and paper for taking down notes for present. Set yourself and listen attentively to our lesson on air. Just a reminder, we will be utilizing the react buttons found in the comment section. If you know the answer or you have a question, feel free to chat them in the comment section. There are teacher moderators that will see and filter your comment. On our last topic in health, you have learned about the postnatal care, which is the care given to the mother and her newborn baby immediately after the birth, and responsible parenthood, which is the will and ability to respond to the needs and aspirations of family. Today, we are going to explore about stages of infection, leading causes of morbidity and mortality in the Philippines, and most communicable disease. These are based on the most essential learning competencies that was given by the Department of Education. After going through this module, you are expected to, number 1, assess the stages of infection. Number 2, analyzes the leading causes of morbidity and mortality in the Philippines. Number 3, causes the most communicable, and number 3, causes the most common communicable. Before we proceed to our topic, let's have a game entitled 4 Pictures, 1 Word. You are going to identify the words based on the pictures that will flash on your screen. You will be given 10 seconds to think and place your answer to our comment section below. Are you ready? Let's start. Number 1. What is the word? Your 10 seconds starts now. Time's up. Correct word is common colds. Number 2. What is the word? Your 10 seconds starts now. Oops. Time's up. The correct word is mumps. Number 3. What is a word? Your 10 seconds starts now. Stop. Correct word is yes, dengue. Number 4. What is the word? 10 seconds starts now. Oops, the correct word is yes, mortality. Number 5, what is the word? Your 10 seconds starts now. Correct word is yes, communicable disease. Okay. Congratulations, grade 8 learners. Those words may come across to our topic for this morning. May I remind you that this lesson needs strong parental guidance. It contains words or phrases that may not be suitable for young audiences. Parental guidance is highly recommended. Get ready with yourself for another interesting lesson about stages of infection, morbidity, and mortality in the Philippines, and the most communicable diseases. We have 4 stages of infection. We have incubation stage, prodromal stage, illness stage, and convalescence. When a person is sick, the first stage of infection is incubation. It is the period starting from the entry of pathogen until the appearance of first sign. For example, chickenpox. It takes 2 to 3 weeks of incubation. Another one, common colds. It takes 1 to 2 days. Next, influenza holds 1 to 3 days. And mumps hold 12 to 25 days of incubation. The second stage is called the prodromal stage, which starts from the onset of non-specific signs and symptoms such as fever, headache, and fatigue. Next is the illness. Begins when more specific signs and symptoms appears. For example, the common cold is characterized by sore throat, sinus congestions, and rhinitis. Mumps, manifested by earache, high fever, and salivary gland swelling. Next is the fourth stage, which is the convalescence stage. The last stage of infection is an interval when acute symptoms of infection disappear. The length of recovery depends on the severity of the infection and the sick person's general state of health. Recovery may take several days to months. In this part, you are going to enhance your understanding of the leading causes of morbidity and mortality. Take note of the terms that will you encounter in this lesson, as this will help shape your understanding. They are often used together. They sound a bit similar. So it's no wonder some confusion when it comes only one of them. Morbidity is a condition of being ill, diseased, or unhealthy. This can include acute illnesses as well as chronic illness. Next is mortality. Mortality is the condition of being dead. The morbidity rate examines how many people got a certain disease in a specific geographical location, while mortality rate examines the number of deaths in a population over time, either in general or due to a specific cause. The following are the top 10 leading causes of morbidity in the Philippines as of 2008, according to the Department of Health. Number 10, we have acute febrile illness. Number 9, we have dengue fever. Number 8, diseases of the heart. Number 7, influenza. Number 6, we have bronchitis. Number 5, we have acute watery diarrhea. Number 4, urinary tract infection or UTI. Number 3, we have acute lower respiratory tract infection and pneumonia. Number 2, we have hypertension. Number 1 is acute respiratory tract. The following are the top 10 leading causes of mortality among males and females in the Philippines as of 2018, according to the Department of Health. Number 10, we have for males is transport accident, while in females is remainder of diseases of the genitourinary system. Number 9 for males is other heart diseases, while in female is respiratory tuberculosis. Number 8 we have for males is hypertensive diseases, while in females is chronic lower respiratory infection. Number 7 for males, respiratory tuberculosis, while in females is other heart disease. Number 6 for males is diabetes, while in females is hypertensive diseases. Number 5 for males, chronic lower respiratory infection, while in females they have diabetes. Number 4 for males is pneumonia, while in females is cerebrovascular disease. Number 3 for males is malignant neoplasm, while in females is pneumonia. Number 2 for males is cerebrovascular disease, while in females is malignant neoplasm. The number 1 leading causes of mortality in the Philippines is, yes, ischemic heart disease for both males and. Now, let's proceed to communicable disease. Communicable disease are illness that are spread from one person to another. They are caused by germs and pathogens that are spread by different modes of transmission through direct and indirect contact, contaminated food, water, and air. Pathogens invade the body and release toxins that damage cells and impair normal body function. In severe cases, communicable disease may lead to death. Okay, we have acute respiratory infection. What are the description of this? It is an infection of the lungs that may interfere with normal breathing. Signs and symptoms. We have cough accompanied by short track breathing, fever, difficulty in breathing, sore throat, body aches, and fatigue. These are the preventive measures. Number 1, getting vaccinated is the best way to protect you from the flu. Number 2, take everyday precaution. Observe personal and good hygiene habits and follow the everyday steps to take in life protect oneself from flu. Number 3, preventive antiviral medication. Even if you are healthy but exposed to a person with the flu, then you can be protected by antibacterial. Next disease is pneumonia. The description of this disease is infections that inflames the air sacs, the one or both lungs. Signs and symptoms: cough, chest pain, headache, excessive sweating, loss of appetite, low energy, and fatigue. Preventive measures. When coughing and sneezing, cover your mouth and nose with tissue or hanky to catch the germs and throw the used tissue in a bin or toilet. Wash your hands regularly to avoid transmitting germs to other objects by contact. Have yourself vaccinated to be protected against pneumococcal infections. With smoking. Smoking damages the lungs. Next, we have bronchitis. Description of this disease: it is an infection that inflames the air sac to one or both lungs and the mucus filled up. Signs and symptoms: cough, chest pain, mild headache, mild body aches, and sore throat. Preventive measures: cover your mouth when coughing. Take all medications required. Take the tuberculosis vaccine. Next, we have tuberculosis, an infectious bacterial disease that mostly affects the lungs. Signs and symptoms: cough for more than 3 weeks, too long. Loss of appetite, weight loss, fever, chills, and night sweat. Preventive measures: cover your mouth when coughing. Take all medications required. Take the tuberculosis vaccine. Next disease is influenza. Influenza, a viral disease affecting the nose, throat, bronchi, and sometimes lungs. Signs and symptoms: sudden onset of high fever, aching muscles, headache, fatigue, and weakness, dry cough, and sore throat. Preventive measures: avoid close contact with people who are, stay home when you are sick, cover your mouth and nose, clean your hands, avoid touching your eyes, nose, and your mouth. Practice other good health habits. Next disease is dengue, a mosquito-borne viral infection that may attack any person. The virus is transmitted by the mosquito known as Aedes aegypti and Aedes albopictus. Signs and symptoms: headache, muscle, bone, and joint pain, vomiting, rashes, bleeding gums or nose, and blood in the urine. Preventive measures: elimination of stagnant canal water. Change water in the flower bases regularly to discard eggs. Use door and windows. Use mosquito repellent on. Next disease is sexually transmitted disease or STD. Sometimes they call it STD. Infections that are transferred from one person to another person during sexual intercourse. Signs and symptoms: soreness, unusual lumps and sores, itching, painful urination, unusual discharge from genitals. Preventive measures: abstain from sexual intercourse. Never share needles. Do not share personal items that may have blood. And last and most importantly, educate and inform. Now, let's have an activity. Create an informative poster about things you learned from the lesson. Pass it to your Mapeh teacher. This is the rubric for poster. To sum up our topic, we have 4 stages of infection: incubation, prodromal, illness, and covalescence stage. Leading causes of morbidity in the Philippines. We have acute respiratory tract infection, hypertension, acute lower respiratory tract infection, pneumonia, urinary tract infection, bronchitis, influenza, disease of the heart, dengue fever, and acute febrile illnesses. Leading causes of mortality in the Philippines. We have ischemic heart diseases, cerebrovascular diseases, malignant neoplasm, pneumonia, chronic lower respiratory infection, diabetes, other heart diseases, respiratory tuberculosis, hypertensive diseases, and transport. Now we have common communicable diseases. Acute respiratory infection, pneumonia, bronchitis, tuberculosis, influenza, dengue, and sexually transmitted. Now, get your pen and paper for our assessment. Read the questions carefully, choose the letter of the correct answer, and check your own paper. You have 10 seconds to answer each question. Are you ready? Let's start. Number 1. What should the sick person do if she or he gets infected? Your 10 seconds starts now. Top. The correct answer is letter D. All of this above. Number 2. What type of diseases is caused by the direct and indirect spread of pathogens from one person to another? Your 10 seconds starts. Top. Correct answer is letter C. Communicable. Number 3. What is the condition of ill or unhealthy? Your 10 seconds starts now. Top. Correct answer is letter yes, A. Morbidity. Number 4, we have how long is the incubation period of chickenpox? Your 10 seconds, go. Top. Correct answer is yes, letter D, 2 to 3 weeks. Number 5, which of the following situation is not included in the reporting morbidity rate? Your 10 seconds starts now. Okay, the correct answer is yes, letter C. Case, a 2-year-old who was born deaf. Great job, grade 8 learners! I hope that our lesson today gave you an enlightenment. Remember this, your body is the most priceless. So, take care of it. Once again, this is Christian Moises Carlos from Disciplina Village, Bicnay National High School saying that dito sa Valenzuela City, anuman ang sitwasyon, tuloy ang edukasyon. Goodbye!